Hey, what's up guys? Welcome to episode number 8 of the DPT vlog. In this episode, we're gonna talk about the exam that we took today. It was a clinical skills exam. The stuff that we went over in the exam were things like force coupling, about the serratus anterior, about the trap muscles, about compression, about upward rotation. We have information about adhesive capsulitis. We have things about the rotator cuff muscles. Basically all of this area we got tested on. And so basically we got a lot of slides and we have a lot of lecture slides to go over to study for, right? But then when it comes to the test was very, very conceptual. Everything on the slides, I was like, okay, you know it, but how do you apply it? So the questions were very, very difficult. Now, a lot of people were upset. They felt like it wasn't a good reflection of what they knew. And some people felt like they did okay, which is all fair, right?
Bad, dude. It was bad.
It was bad.
I'd rather have him see all the grades and then give us like a curved grade because I don't like seeing my fail.
Especially then it affects you the whole rest of the day.
I thought it would, but did not end up
well. Probably the worst grade I've ever gotten in my last 5 years.
No, Joe said I can't. Dude, I almost cried. Kind of disappointed. I wanted to get a better grade. It was worded tricky.
It was pretty difficult.
Yeah.
The difference between the first test and this test was substantial.
It was interesting. I need to study more. It means I need to study more and more efficiently.
Along with this test, we also had an anatomy test. So we had a double header today. And on top of that, we got a new software for an iPad. Basically, we take the test on the iPad. So instead of having a paper and a scantron, everything's electronic now. And you just upload it and then it gives you an automatic grade right after you take the test. Some people like that they got their feedback right away, and some people said, I kind of want to wait until a little later.
How do you feel about the giving back the grade right away?
It's heartbreaking in a way. Like, should I submit it? Do I submit it? If you get a good grade, then it's like a relief.
Yeah.
But if you get something horrible, it's like knowing that instantly, at least like after the test, especially now that we have like an anatomy test right after, does it like lower your self-esteem or your morale for the next one if you got something low?
I know it's good for us in the long term, but I'm just so used to like scratching answers off and stuff. And
I can't write on it. I want to write on it, and I want to tell them what's wrong with every question. So I'm a little bitter right now.
It's okay.
Are you bitter?
I am bitter. It was very hard.
Oh, I don't like it.
You don't like it? You hate it?
Like, I'm more traditional. I like pencil and paper because there's less risk of like messing it up.
Yeah.
But I understand the move technology, but it's kind of like an adjustment, you know.
pros and cons.
Pros and cons.
Would you rather have it waiting so you get the results later, or?
Well, you can always keep with the hope thing going.
Yeah.
You don't see it, you always have hope.
Yeah.
Once you see it, it's done.
I think despite the fact that people got good grades or people did not so well, there is a lesson to be learned. And the lesson is that we're in grad school. We are pursuing a doctorate of physical therapy. And we might come in from our college with a valedictorian or a summa cum laude, but you come into this program where everyone is going to be challenged. So I think today was a very big day to be able to be reminded and humbled and say, okay, well, you know, maybe I don't know everything and I need to be more like a sponge and just absorb more knowledge and just accept the fact that I'm a student, I'm learning, and I'm not the best. And with proper training and proper guidance, I can be the best and I can be a difference maker.
One more thing I just wanted to point out, because I was just talking to the third year. His name is Eric Golan, and yeah, he was telling me that, you know, you're not defined by the grade that you get. You're not defined by the number that you get on the quiz or the exam. It's not about regurgitating your information that you've learned, but it's more about how can you be better as a clinician, how can this test help you improve, and how can this test just make you grow. right? Because it's going to challenge the way you think. It's going to challenge the way that you've approached questions and situations. And and that's really important. What's up? So you are not defined by the number on that exam, but you are defined by the image of the Lord. And He's the one who's created you. He's the one who's made you who you are today. And that I really believe that it's not about just how you perform, but it's about what your purpose is. It's not about the purpose of your performance, but the purpose of what you were created for. So yeah, that's it, you guys. Enjoy this day. You were made, you are beautiful, you are awesome, you are handsome. Yeah.
So today I learned a valuable lesson. Work hard in everything that you do and work with an intention to be better. Don't just memorize, but learn intuitively so that you can apply things just like in the real world. And be a sponge, be a learner, be someone who is willing to take in information and more information and more information and more information. Yes, this test knocked us down, but it's also important to stand up and have that courage to say, okay, you know what? I'm gonna do another one. Another one.
Another one. Another one.
Alright guys, I hope that put some motivation into your week this week. Next week we have our practical on Monday. It's gonna be crazy. It is going down. Have a great one, you guys.